Hello, and welcome to Yale New Haven Children's Hospital. My name is Samantha, and I'm a nurse here at the hospital. You may see me during your stay. Our team is grateful to be part of your care while you are here. During this video, I'll share a little bit about what to expect during your hospital stay and introduce you to some of the people who will care for you. I'll also share how to get around the hospital and the services available to you and your family. There is a written welcome guide located in your room. I'll be referring to the guide, which has additional details. Let's get started. If your family drives a car to and from the hospital to see you, there are many options for parking. The Air Rights Garage is a walkway directly attached to the hospital, and there are many self-parking lots available nearby, as well as valet parking. Parking rates apply. The welcome guide has specific details about parking, which may be helpful. During your stay, you will meet healthcare professionals with different roles, such as a patient care associate or PCA. The PCA acts as a nursing assistant. Then there are the registered nurses, or RNs, attending physicians or doctors, and advanced practice providers. As a teaching hospital partnered with Yale School of Medicine, you may meet fellows, who are doctors enrolled in additional training in a specific field, and residents who are working toward becoming board-certified physicians. Depending on your care needs, you may also meet other specialized team members, such as respiratory therapists, social workers, dietitians, rehabilitation specialists, and more. Descriptions of everyone's roles are in the printed welcome guide. It's common to be nervous about being in the hospital when you don't know what to expect. Our child life specialists are specially trained to help children of all ages understand what will happen during their hospital stay. Child life specialists explain things in a way that will help you cope with your hospital experience and understand your illness or injury and any discomfort you may have. They can help to support you and your family during your stay and even help you have some fun. The Child Life program also includes art and music therapists, a gaming specialist, healthy humor clowns, and our fuzziest team members, our facility dogs. To prevent the spread of infections, it is important for everyone to wash their hands regularly. You may have noticed outside of everyone's room is a hand sanitizer dispenser. We encourage everyone to use hand sanitizer or wash their hands with soap and water before entering your room and when leaving. When you look around your room in the hospital, you see different types of equipment. You may see things like a machine that monitors your heart and breathing, an IV pole with tubing, and a call light for you to request the nurse to come to your room. Some of the equipment makes sounds, like bleeps and blips. Your nurse gets information from these machines sent to her special phone to keep track of how you are doing and respond if you need assistance. You may notice that our rooms are different from one another. Some have one patient to a room and some have two, where you may have a roommate. Room assignments are made based off of how many kids are staying in the hospital and the type of care they need. There are kids who need to be monitored more closely and with even more specialized equipment during their hospital stay because of their care needs. These patients stay in our Pediatric Intensive Care Unit, also known as the PICU. The PICU is on the same floor as our other pediatric units and shares the same resources. Your parent or caregiver is welcome to sleep over in your room. Although it's not safe for them to sleep in your bed, we provide a separate bed for them. If your family would like to stay nearby, but not directly in your room, the Ronald McDonald House is just across the street. For more details about the Ronald McDonald House and eligibility, ask someone from your care team. Every day, your medical team gathers in your room with you and your caregiver to discuss your plan of care. We call this rounding in the hospital. This is a great time to ask questions. It helps to write down questions as they come up so that you or your caregiver don't forget them when the team rounds. Ask your nurse about joining in on rounds. You will notice that while staying with us, members from your care team will check your name and birth date on your ID bracelet before providing care. This is important to assure any care or medication is specifically for you. A nurse or patient care associate will check your temperature, blood pressure, respiratory rate, and heart rate several times throughout the day. If you need any medications, your nurse will provide this to you. If you need to have blood tests, we have a lot of ways to make this as easy as possible, and our child life specialists and nurses are here to support you. During the day, members of our environmental services team will come by to clean and freshen up your room. There may be different visitor guidelines based on the number and types of illnesses in the community, meaning outside of the hospital. This is to keep you healthy and safe from infection. Our visitor policy may change at any time. Please ask your nurse for the most up-to-date guidelines. For your safety, as well as others, we ask that if any visitors are sick, they do not visit, including but not limited to fever, sneezing, stuffy nose, sore throat, cough, diarrhea, or vomiting. Did you know you can order food right from your room? There may be certain things that you should or shouldn't eat to help with your healing. Your care team will talk with you and your caregiver about your options. You will receive a menu that has instructions on how to place meal orders over the phone. Meals can be ordered anytime between 7 o'clock in the morning to 7 o'clock in the evening. Your cook-to-order meal arrives directly to your room. If your caregiver isn't with you at mealtime, they can call the number to order for you from wherever they are, or you can ask your patient care associate or nurse to help you. For your family and visitors, there are cafeterias on the ground floor of the hospital and vending machines in the Coles Lounge located on the West Pavilion 7th floor near the visitor elevators. If your caregiver does not want to leave your room, they can order just like you and purchase their meal. Yale New Haven Children's Hospital offers support services and spaces for you and your family, from quiet spaces to playrooms and resource centers. Our Family Resource Center is located on West Pavilion, room 701, and has information for families that may be helpful. Your caregiver can stop by to use the computer, have a hot or cold drink, a snack, or simply take a quiet moment away from the unit. Also, on the 7th floor, but in the South Pavilion, is our playroom. We also have a dedicated teen room just for adolescents. For some fresh air, our healing garden is located across the Sky Bridge in the North Pavilion and is open year-round, weather permitting. Check with your care team to see if you are able to leave your room and to explore some of these spaces. The hospital is a big place, so to help your family get around, they can download the YMYNH Go app for a map of Yale New Haven Hospital's York Street campus, which is where the Children's Hospital is located. The map will help them locate things like the cafeterias, the chapel, and main entrances. I hope this video was helpful for you and your family. The Welcome Guide has a full list of our services and resources, as does our website. Please know that we are all here to help make your stay as comfortable and enjoyable as possible. Don't hesitate to ask your care team members any questions. We hope you have a speedy recovery.